Hello, good morning. Good morning.
Good morning, Miss.
Okay. Now I'm going to share my screen. Can you all see my screen?
Yes, Miss.
Okay. So these are the learning objectives of our today's session under the assessment process in health and social care settings. So at the end of today's sessions, you will be able to identify. So there are some ways, right? So we studied what is the meaning of assessment and how we can conduct an assessment in a health and social care settings. Like when we talk about the patient, so if you need to collect any information from the patients you need for a treatment section, so how you can collect the information. So as much as possible, how you can develop interaction with the patient. So with that interaction, how you can get the maximum information of the patients we studied, right? And in addition to that, we studied there are a lot of assessment tools are there. So these tools or the techniques or the instruments, so they are also very much important, right? Because not always we can get all the informations only verbally. So there are some instances where we can use some different types of tools like questionnaires or scale in order to obtain an information about a particular condition from the patient, right? So there are different parts are present in this assessment process. So today what we are going to see is, so yes, so you can do the assessment. So once you are a compatible person, you know, right? Because you will have a guideline and that guideline has so many questions. So just asking those questions, you can, by filling the answers for the question, yes, we can develop a kind of informations, but you need to instruct the others, right? Others means the other healthcare professionals, right? So why you are spending this much of time with the patients to collect the informations, and or the other family members or other people, right? So you need to instruct them. So why this assessment is important. So at the very beginning we studied what are the importance of this assessment, why we are conducting the assessment prior to planning any management in the health and social care sector. And this assessment, yes, it is not only confined to the health sector, but when we take any kind of social sector, first we need to gather some informations in order to plan a program or in order to plan a patient care, right? So program means it comes other than the health sector, other workplaces. And when we talk about the health sector, yes, it is mainly we are focusing the patient care. So whatever the instances, we need to gather some information. So why we need to gather the information? Because then only we can plan, right? So we can put a structured framework like a planning, and with the plan we can implement to identify whether the goal then for, so and also because prior to anything, first we set up some goals, like even it's a patient care, we will make some goals. So when we talk about the patient care, the goals will be the basic goal will be we need to enhance the quality of life of the patients who are coming or who we are treating. And when we talk about the other workplaces, so each and every institutions, they may have some task oriented work. For example, so one company, they need to fulfill a particular order within 1 year, right? Or the when we talk about the banking, they need to recruit the consumers or the people, the customers about within 1 year. It can be a 12 lakh. So in that manner, all of them are working in a goal, right? So we also working to achieve our goal, but the goal is different, right? Our goal is different from them, but however, each and every institution, so any employees, we are having one goal. So we are working in order to achieve those goals, right? So if we need to achieve those goals means first we need to plan a, in a good manner. So we need to formulate a framework or a planning, right? So without plan, we can't execute anything because we didn't have any idea how we are going to achieve those goals. So after setting up a goals, yes, we need to plan how we can do, and within 1 year means what are the things that we can do in order to gain all those achievements. And when we talk about the patient care, yes, so if a patient is coming with the road traffic accident, so if you need to improve the quality of care of a patient, so what you can do, that means our planning, yes, so we can manage the patient first with the conservative management, like yes, we can take an x-ray, and we can admit the first we need to admit the patient and we can take the x-ray, and then we need to check whether the patient body is okay for the surgery. Then after the surgery, yes, you need to convince the patient. You need to get the consent from the patient. That means the approval for the surgery. And in addition to the patient's approval, yes, you need to collaborate with the family people and you need to convince them, right? So after the surgery, again, you are having a big part, like you need to educate your patient, right? So after the surgery, how he or she needs to be, that particular person needs to be. So after the surgery means sometimes we ask the patient to change the dressing. If it is that means a major surgery, we will keep the patients around 1 week or 2 weeks under the observation, right? But if it is a small surgery, yes, so the doctor, the physician come and he will check, and if it is okay, yes, then the physician may discharge the patient. And once discharged the hospital also, again you are having some responsibility to teach the patient, right? In the hospital setups it is a different, then how you can handle the patient in the home setups regarding the diet, that means the food, how they needs to take in order to increase the healing or the recovery of the wound. So those things you need to implement, right? So those things we will plan, okay, what the first thing what we need to do, then after that how we are going to do those things. But before this, so planning and implementing, so first you need to gather some information from the patients. Why? Because all the patient's body cannot cooperate for the surgery, right? Or sometimes the medicines that we are going to use during the surgery could be allergic for the patient. So if it is become allergy, then again the complications will arise. So in order to identify those things regarding the patient's personal informations, it can be a physical, psychological, social informations as a whole individual. What we need to do is we need to gather those informations from the patients for the effective planning and the execution of our planning in order to achieve the goal. So for that purpose only, we are trying to get this informations which we are telling as an assessment process, right? So most of the other people won't know, right, why we are doing this assessment and why we are providing much more importance for this assessment. And sometimes some people may arise the questions that without assessment can't you do anything, right? Yes, we can't do anything without the assessment, right? Or if you think that yes you can do, but the ultimate, that means the last outcome will be not effective. What we need to get, we can't get, right? So for those people, you need to instruct. That means instruct means you need to educate them, right? So what is this assessment process and what? So previously we studied. So what is this assessment? What are the types of assessment and why we are studying the assessment process? So here today we are going to see how you can educate the other people. What are the ways they are present, or what the forms that you can use in order to educate regarding the assessment process to the other people. And then yes, so assessment process means it is not always a positive part. Both can happen, right? It is having both good and the bad impacts, right? When we take the assessment in accurate manner, it is a good or the positive impact. But if your assessment is not in an accurate, or if it is an improper manner, again it's going to have a negative impact, right? Then explain how to develop a care plan. So we studied a separate part for the nurses assessment, right? So I told you, well, because the nursing management, it's we are telling that nursing management or the nursing care plan is more accurate, because when we talk about the nursing care plan, it includes a patient's whole health, right? So we can tell it is a kind of holistic approach. Holistic approach means whole. We are considering one individual as a whole. That means we are focusing a patient's problem physically, emotionally, psychologically, socially, spiritually, and for each and every problems we are developing a plans, and we are developing a goals. And then for each and every identified health issues, that means that health issues means it can be physical or psychological, whatever we are executing, right? So that's why the nursing management, or you can tell it as a nursing care plan, is a more accurate one. Why? Because when we talk about the medical care plan, so once you entered into the, when you start to work in the health sector, you can identify the difference, right? The physicians, that means the doctors, they only focusing on the physical symptoms, and they try to put their care plan always how to sort out the physical health issues, right? And if it is although if we identified any persons with a mental illness also, they will treat it like a only, yes, we need to sort out that mental illness of the patients, right? So in that sense, they won't focus on if the patient is having any physical problems or whether the social problems get affected. So they won't focus the other dimensions as well, right? Only one dimensions, and they try to sort out only that problem. But the nurses, although the patient is admitted for one problem, they needs to check or they needs to cover the all the background problems as well. What is the basic problem make the patients to admitted to the hospital, right? So when we write a management, so we are having a set of parts, right? So almost for any management, the first one is assessment. So we also having a guideline, a separate guideline that develops by the nurses in order to get maximum informations from the patient. So it is a kind of assessment, right? Then, yes, I told you the diagnosis. Simply diagnosis means the problem. What is the problem of the patient? But when we talk about the nursing diagnosis, it is a way of writing, but no need to go deep. That simply you can identify the diagnosis means problem, right? So sometimes patient may complain that he is having a pain. It is one diagnosis. Then yes, again, we also will plan. So if patient complains about pain means, so how we are going to manage that pain? What are the plan? That means what are the actions we can take as much as possible to alleviate or to reduce the pain of our patients, right? So all the available options we are list outing under the plan. Then, according to the patient condition and according to the order from least to highest management, we are providing or we start to execute for the patient. Then we are evaluating. So evaluation means yes, as it is a pain, again we may use the pain scale to check how the previous pain level and how after the management. Or you can just ask from your patient verbally how you are feeling, are you comfort or not. So those words we can check whether our plannings are okay, whether the patient is feeling now comfort or not. So that's why the nursing care plan is very, very important. And there are now a set of professionals called caregivers. So these caregivers also who are trained by the professional nursing officers, because some parts of the nurses will be comes for the caregivers as well. So these caregivers, they also can follow this care plan. So whoever the people working in a health and social care setups, you need to plan a care plan. Care plan means how you are going to treat your patient. So you are putting a kind of a framework, right? So what first you are going to do. So the planning of care, we are telling it as a care plan. And then we can see how we can evaluate, right, the effectiveness of assessment process and outcomes. So how you can tell that your assessment, and with that assessment the outcome on your patients, whether it is effective or not. So those things we need to evaluate, right? So these are the learning objectives of today's session. Next, we'll see so how you can instruct others about the assessment process, right? So if you need to teach them or educate the other people like your colleagues or your family members or other healthcare professionals, if they ask that why you are spending more time with the patients to take informations, right? Or sometimes patient also may ask, right? So if you ask so many questions, even the patient also may ask that why you are asking so many questions. Is these questions are important to my care plan? Or those questions sometimes patient may have, right? So you need to instruct them why this assessment process is important. So if you need to instruct them, so how you can instruct them? So what are the techniques that you may use in order to instruct your patients, right? So the first one is conducting supervision session. Yes. So supervision session means it is not, it can be useful for the like junior and the senior employees, right? So if a junior employee starts to work, then the senior employee may conduct a supervision session. So in the supervision session means your supervisor, he or she may ask you to conduct the assessment. Okay, so they may ask, okay, demonstrate me how you will have an assessment with the customer or the consumer, right? So it is a supervision session. So through that supervision, yes, so your supervisor, she or he may sees, right? So when you are demonstrating, they may see how you are demonstrating it, and once you finish, then they starts to comment on your work. That means they will provide the feedback to you. So those feedback, again, it will be helpful for you to improve your skills of taking the assessment. So that is one part, conducting supervision session. Providing a handouts. So handouts means like a tunes. So I am providing these lecture notes, right? So like these lecture notes, so we can include, right? So we can include all the uh, informations regarding the assessment process in a written form, and you can distribute to the people that who you need to educate them. So the steps of taking the assessment, and why this assessment is important, and what is this assessment means. So all the things you can write in a paper, or you can get a printout of it, and you can distribute. So that is a handout. PowerPoint presentations, yes, again, same. Yes, you can include all the informations in a PPT, and you can ask a small group, or you can, if you need to explain to a small group of people, then you can invite them for a session. So you can arrange a particular session for around 15 or 20 people. Then you can put on your PPT and explain, right? Distribution of leaflets, yes. So leaflets means, so once you may see, right? So it's a kind of small papers, right? So it is not actually a very, like, it's not a lecture notes, right? Not a big A4 sheets or something, but so when you take a A4 sheets, you can have a small parts, right? A small chits. Okay, so like during the advertisement in the roadside, they are distributing some chits now for uh, for some company, or for if any persons newly open any shops, so they may provide some, like we are having 20 percentage offers. Likewise, they will distribute a small papers, right? So those papers, we are telling it as a leaflets. So in that leaflet, it won't contains all the detailed informations, but so those leaflets includes only the important parts in an attractive manner, and also it makes all the people can understand quickly, right? So the words that they are using, mostly they will use a simple words. Even a common man also needs to understand, and most of the time they use a pictures, right? They use the pictures which are illustrated what we need to say by our words. So because pictures means all the people, even an uneducated person also can understand with that picture. So that is the importance of this leaflets. So you can use or distribute the leaflets to the community, a group of community. So then they also know why. Because a group of community means those are the people may come as a patients in another situations. So if they knows, okay, so once we entered into the hospital, so the nurses or the doctors, they are asking so much of questions because for our purpose only, for preparing or for developing for our care only, they are asking these questions from us. So what they will do, so they won't hesitate, and they won't agitate, and they won't get mad at you. They will cooperate. They will start to cooperate. Why? Because already they are having some kind of idea regarding this assessment, right? And also, yes, again, the family people, they also may understand, right? So for our patient, for our person's care only, they are asking questions, because then only they can have a detailed idea and to develop for the care plan. So likewise, the person, so the people, they starts to understand by themselves the importance, right? So that is another we can you can do in order to instruct the others, right? conducting staff training and developing programs at the workplaces. Yes. So this instructing the assessment process, it is not only important for the normal people, but there are some staff, that means employees as well, they are not aware about this assessment process, right? So if we ask them to take information, means if they are not aware the importance of this assessment, just they will do, it's like a just they are going and taking an overview informations, right? Why? Because they still don't know the importance, the essentialness of this assessment, right? So we can plan. So the employer, they can plan a staff training program, what which it can emphasizing this assessment, right? At the workplaces, or some, that means staff training or staff developing programs. Yes, they can prepare, and they can ask the patient, so the employees to involve or engage in those programs, and at the end of the programs, yes, they can reward or they can appreciate their presence. So in that manner, so they can develop the professionalism in within the employees as well, right? And conducting workshops which emphasize about the different aspects of assessment. Yes, again the workshops. So workshop means, yes, it can be like a 1 or 2 days. So you can, the particular institution, they can arrange different, they can invite a different higher personals who are, or the specialist. So because if we invite a different specialist, means they are different, they may have different experiences. So once they start to reveal all the or share those experiences, yes, again the other people also will get some informations, right? So in that sense, yes, we can have a workshop, staff developing or staff training program. So these are some of the common things that, and it is very easy things, right? It is not having that much expensive. It is, yes, it's somewhat cost effective, you can do. So with this, you can make the other people to know about this assessment process, right? So these are the common parts. Now we'll see what are the positive impacts or the positive influence of assessment process. If you do the assessment, means what it can cause to the other people. That means both the people who are involving in the assessment process. So for example, if there is a nurse patient, means, so what this assessment, what it's going to do in a positive manner for both the patient, at the same time for the nurse, right? So first one is able to get a general understanding of a whole health of an individual. Yes. So with the basic assessment, not in a deep one, just with a basic assessment, you can get a general idea of your patient health status, right? So where the patient is coming from, why he is admitted, and what is his economical status now, who are the family members living with him or her, whether he is having a good that means the whether the economic that good status of family, so how many children, so likewise, so we can get some general idea about the patient, so what kind of dietary habits he is having. So with the assessment, yes, actually we can have some kind of general idea about the individual. Helps to monitor the individual health status over time. So at the very first, you can get some information, and also after, once we commence the once we commence the care for the patient over the time, that means after 1 week or 2 weeks, again this assessment will be helpful to monitor the patient's health status as well. Why? Because each and every day, right, each and every day you need to take some informations. So information in the sense, no need to think deep too much at the first. Yes, we will take all the informations, but for example, if the patient admitted by the fever, again the second day we need to monitor the temperature, body temperature, and we are checking, right, or you can ask the patient how he is feeling now. So those are assessment you are asking. So by measuring the temperature, body temperature, you are checking whether the temperature decreased or not. Why? Because you planned a treatment and you execute the treatment. So after the treatment, you are checking whether your treatment option is effective or not. Right? So with the first assessment thing, that means the very first beginnings, the informations that you got from the patients, it will be helpful to compare within the following days, right? So with that, the very first beginning, the informations only, you are going to compare the patient's condition. So at first the body temperature was 180. So the second day it is 175, then third day 120, and after 1 week now the body temperature is 37 degrees Celsius. So you are comparing. So that also important for monitor a particular individual's health status over a period of time. Motivates a healthcare professional to involve with the patient care with the help of detailed assessment. Yes. So this assessment may motivates each and every healthcare professionals to involved in the patient care. Why? Because if they starts to because this assessment process is another important part for developing a interpersonal relationship with the patient, right? So because at the very first beginning, if you have a good communication with your patient and if you develop a good rapport with the patient, again you will think, right? So we need to, so if that means if you develop a good rapport, sometimes patient may try to tell all the informations to you. In that sense, you also may think, right? So I need to explore more about the patients and see whether I can help to sort out the patient's problem or not, or what this patient is thinking, always thinking about inside his or her mind. Okay, so you are having some motivations. So those motivations, what it will do to you, without your knowledge, indirectly with that motivation, you starts to engage more with the patient care because you tried what I can do to make this person healing very quickly, right? So again, the assessment is important because the very first beginning informations will makes you to think in all these ways. Disincentives. Disincentives means the assessment as positive as possible, which helps the individual to heal quickly, right? So whenever you are taking the assessment, so you need to keep that assessment as much as possible, right? Sometimes over the time, uh, if you identify that the patient condition is get worsening, but it is better not to inform that directly, right? So for example, so the patient admitted due to some disease condition means sometimes with the treatment also it won't improve, right? The condition starts to worsen. In that sense, although you are knowing, what you need to do is you need to provide some positive energy to the patient, right? So that means some there are not all the parameters. For example, the patient admitted with high blood pressure, right? Very, very, very high blood pressure. But after 2 or 3 days, the blood pressure reduced like 1 or 2 points, right? Normally we are telling that pressure, that means high blood pressure above 180 is not good for health. So the patient at the very first beginning admitted with 200, right? Now after 2 days, once you again monitor, it reduced to 198. So still it is not good for the patient, but however, it reduced by 2 points, right? So what you need to do is, so during the assessment, normally patients, they are expecting, they are, because they doesn't know what happens to their body, so they always expecting the particular care provider to split out all the informations, right? So what you can do after measuring, you can tell, yes, now your blood pressure reduced by 2 points. Now it is 198. So don't feel anything. So we will work together in order to reduce your blood pressure furthermore. But still 198 is bad for the patient health. But what you are telling, you are making the patients to think positive, right? So 200 to 198 means then the patient also will think, okay, so I need to cooperate with them to heal my body. So that is we are telling it as disincentives. So you need to keep your assessment as much as possible in order to make the your care receiver to heal very quickly, right? Then improved communication, yes, it is very, very important in the health and social care sector, in any sector, right? Any sector. And when we talk about the health sector, in each and every part of working, this communication is important. And that communication is, it should be very, very effective and best communication. And then aids means it's helping, right? So it helps the care professionals with concrete information when preparing the lifestyle changes for their care receivers. Yes, so you are going to identify the patient's normal routine lifestyle. Then in order to make the patient's life, or to in order to improve the quality of life, there are some instances style of your patients. In that sense, if you have a concrete information, means a firm informations about the patients, right? So because sometimes the higher people, they may ask, your supervisor may ask, okay, why you are telling you need to change this plan? In that sense, you need to be very, very firm enough with the evidence to debate with them, right? So why I'm telling is because these are the problems I identified. So if we need to make this person to live a long life, means we need to change all those things. Wait. Right? So in that sense, we need to have some concrete information, right? Helps the patient to get involved with their care or treatment planning. Yes. So this assessment again, in the patient side, when we see the patient sides, they will help the patients to get more involved, right? Because when you ask a detail and a proper informations, then the patient also may think, that means they may think that, okay, so this person is, or this healthcare provider is more conscious about my health status. That's why he or she is spending nearly 1 hour and asking all the questions from me. So what I need to do is, on my side, I need to cooperate with them. So I need to engage wholly, and I need to follow whatever they need. So those kind of thoughts a patient starts to develop when with your assessment. And those will be developed only with your accurate assessment only, right? So we studied now how we are going to take the assessment, what are the components are present in the assessment. So with the proper communication skills, the words and the body language that you are using, in addition to that, by using those guidelines, if you incorporate or combine both the things and used for the assessment process, actually the patient will feel a secure, a protect, right? And sometimes some patients may think, okay, so you are the person, so you are very concerned about their health status, and then they start to cooperate with you, right? So when the patient, yeah, on the patient sides, they will involve more and more into the care planning, able to develop outcome or goal-oriented health promotion program. Yes. So with the assessment again, for the planning, right? For the execution, we need to plan. So already we will plan a kind of goals or the objectives. So if we need to attain that goals or objectives, means we need to prepare some programs, right? Or program means uh, or the policies. Policies means it will be comes for the other workplaces. But in the health sectors, yes, we can develop some programs like health promotion programs to the community level or to the individual level or to the group level, right? Helps to measure and monitor the health status of the community, right? So this assessment process not only helpful for a particular individual, right? But it will also going to influence a group of people, like a community, a population, right? A nation worldwide, right? So the simple assessment, simple information gathering having a much more influence even on a worldwide, right? So for example, corona issues. So during the corona issues, so we gained more and more informations each and every second about this corona. So how? Because there are a set of people who always involved in gathering the informations, right? So then they publish to all over the world. It is also a kind of assessment. Why? Because assessment means simply we are gathering the information in some systematic way, right? So basic is information gathering. So in that manner, so you can educate or you can measure and monitor the health status of the community. So normally this will goes as a research, right? So you can take, as I already told you, you can take one topic that that topic, it should be express the most common prevailing health problem of a population or a group of people or a society, right? Then you are going to measure them and monitor them, right? So why these people are facing these health issues and what are the reasons behind them and what you can do to improve the health status. So what are the activities we can implement or execute them. So if you need to take all those things means what you need to first do, you need to gather the informations, right? So you need to identify why these people are having these problems. So for the identification means what we are doing, yes, for the research purpose, you can distribute a questions, a set of questions. You can distribute a group of society or a community which print a set of questions which are printed in a paper, or you can have an interview that you can take a group of people and you can ask questions, then they will provide the answers for that. So for the measuring and monitoring even a community, you need to get the assessment, right? Engage in health and resource management process. Again, this assessment is not only helpful for the health management, in addition to this resource management as well. Resources means it can be any kind of resources, manpower, environmental resources, economical resources, that means financial. So whatever the resources, yes, we need to have some assessment, right? For example, so in the hospital setups, so we are having so much of tablets, right? So those tablets are one resources that we are having. So tablets in the sense we need to have some kind of informations, right? So so that means what are the tablets? So which tablets is used for which conditions? And how many tablets used by each and every nurses to the patients? How many tablets we got from the pharmacy? And how much remaining? Whether we need any other more tablets more. It is one example. And again, if we talk about beds in the hospital, yes, so we need to check that as well, right? So if the patient, so normally if a hospital, that means a ward is having 20 bed means, but the admitting of the patient sometimes may increase. During this corona period, more and more people admitted to the hospital. Sometimes we all heard no that there were no any places to keep the patients in the hospital because it was filled. Each and every hospital, it was filled with so many patients. So in that sense, again, we are going to gather the information, right? So how many patients are coming and how much of them are discharging and how many beds we need more to accommodate all the patients come. So those information. So it is another kind of resource management, right? So for the resource management, for an effective resource management, again, we need to have this assessment process. Yes, again, if you need to change your behavior or your client behavior and to reduce the health risk, right? So because some behavior of your client may cause risk to the health. So if you, for example, if a patient is having a lung cancer, okay, so the patient admitted with the lung cancer and also he is a smoker, right? It's a kind of, he is a smoker for around 10 years and he can't live, okay, he is unable to stop his smoking habit. In that sense, so with this newly diagnosed lung cancer, if the patient continued the smoking, then what it will happen? So the patient won't survive, right? He may die within very short period of time. So for this, so first you need to identify it, right? So if you doesn't know that the patient is a lung cancer patient, so sorry, the patient is a smoker, then you can't develop a good plan. So during the assessments, you need to check, right? So whether you are having a smoking habit, then if the patient tells, yes, I'm a smoker, but I can't stop my habit. So in the sense, you need to provide some alterations how the patient can stop the smoking to had a good life, right? So this assessment again, it helps to change the behaviors and the health risk with the time. And again, you can plan and deliver the most effective care to those in greatest needs. So yes, again, so you need to identify, right? Who are the people needs the care immediately, right? So for an example, in a one shop, it got exploded, right, due to the electrical problem. So it get exploded, right? So the people who were shopped during the explosion, most of the people, around 100 or more than 200 people, they get affected, right? In the sense, so first you need to check, right? So who are the people they need immediate management? That means sometimes some people may get damaged severely, so we need to provide the care for them in order to keep them survive, right? But there are some people who were not who may have some small scratches, right? So for those small scratches or wound, we can make them to wait for a little longer, right? They are not needing the management immediately. We can hold their management for some times. But if the person get damaged, injured severely, and there is a very high blood loss, so first you need to check. So this is the first person. So how you can classify them with this assessment process only, right? So you can first you can identify it, okay, how many people get damaged. So it is a kind of statistical informations you are getting, right? So how many people were there during the explosion? Okay, 200 people. So how many people dead? Because providing the care to the dead people also not useless. Sorry, it is also useless, right? So first you need to identify, okay, dead persons, 20 people died. So there are 13 people who are in danger. And again 100 peoples, yes, we can manage them after 1 hour because they were not damaged, injured heavily, only a small wounds. So it is a kind of statistical information you are getting quickly. So with that with that classification, you can identify, okay, who are those 13 people. So you can provide the treatment immediately for those 13 people, which can help to survive the patients, right? So without getting those statistical information, sometimes you may need to provide the care. So you may have the patient already dead, right? Already dead, but you may think no, the patient we can provide the care. So in that manner, so providing the care to the already dead people can also make the immediate need people in danger. So for that, this assessment process is important. So we can identify, okay, we can separate and we can identify who are the people in greatest need and how we can plan and most effective management in order to improve their survival rate. Find out about and address the inequalities in health. Yes. So again, this assessment, we can identify the inequalities. It is our first module. So we studied what is this inequalities, because some people, due to their protected characteristics, they were not treated by the people equally, right? So sometimes they are not receiving the health services equally due to the disparity. This discrimination makes the people to have health inequalities. So with the assessment only you can identify why. So the patient or the people may tell, so I am this gender person or I'm this age people. So due to my gender or due to my age, they are discriminating me. So you can identify, right, the health inequalities. Required to prioritize health improvement actions. Yes, again, so you can prioritize the health improvement action. So which actions we need to provide priority in order to improve the health status of the patient. Optimizing the independence of working. Yes, again. So this optimizing the independence of working for the healthcare professionals, right? Why? Because if you get as a healthcare professionals, if you get all the necessary information from the patient, then you no need to rely on others, right? So sometimes if a physician come and ask anything, so if you are firm enough, that means if you have a concrete information about your patients, you no need to get scared about them, right? Because you are having all the information. So if you need to change any plan of care, then you can provide those informations why you are telling that you need to change the plan of care. You can provide those evidences to the particular physician, right? So you no need to depend on others. You no need to depend on orders from the high authority people, because you are having an evidence. Although if you changed the plan of care, then you can propose those evidences. Why I changed the plan of care? So this is the reason, right? So no need to rely on others, no need to get scared while seeing the higher persons, because of whether if you have a good and accurate assessment only, right? Assessment also, if it is a complete accurate assessment only, you can survive. Otherwise, if you make any mistakes in your assessment, or if the information provided by the patient is also not enough, then you can't work in an independent manner, right? It provides a baseline for planning a person-centered ways of working. Yes. So normally in the health sector, we are having a patient, person, or the client-centered work. The patient is the important one. So you can't apply a same treatment option to all the patients admitted to the hospital. So for each and every one, you need to plan a different management. For those planning, yes, we need to get this assessment. Helps the care providers to develop the knowledge and skills. Yes, when we see the health professional side, so with the assessment, we can develop our skills and knowledge, right? So if we find out that if for the assessment, in the assessment you find out, right, whether you are a compatible nursing officer, whether you are having a proper, or whether you are practicing or maintaining a proper communication pattern. So that means if you are having a good communication skills, then you can develop a good relationship with the patient quickly, right? So if it takes a longer time for your patients to develop a trust on you, means that means you are not acting in a proper way. So you can find out uh, your behavioral activities. So what are the drawbacks that you are having within yourself, you can identify that easily, then you can work on it in order to develop those things. And then ensure the care resources are allocated where they can give maximum health benefits. Yes, again the same. So you can identify with the assessment process who are the people needing the resources more, and who are the people they are lack of resources. That means who are the people they are getting the resources more, and who are the people lack of resources. So with the assessment, yes, you can distribute the available resources accordingly, like your care management, right? Systematic and continuous collection of client data. Yes, so this assessment, it is a kind of systematic way. So why we are telling it is a systematic way? Because we are following a kind of guideline, right? A structured way. So that's why it is a systematic and a continuous collection of client data. Yes, so with that you can collect your client data continuously whenever you want. And yes, it is focused on client response to health problem, and it influence the choice of therapies and clients responses. Yes, with the assessment you can identify what the patient having in their mind regarding their management options, and how the patient, so when selecting the therapy options you can identify it, right? So you can instruct the patients, and at the same times you can identify with the patient's conditions, which management will be more fit for them. So those things you can identify. So these are the positive impacts of a good assessment process. If you followed a good and accurate assessment process means actually these positive impacts you at the same time your client may encounter, right? So are you all clear up to now, or do you have any questions?
Clear, Miss.
Okay, thank you. So at the same time, although we are having lot of positive impacts, sometimes this assessment process may have a negative impacts both on the patient as well as the healthcare professional as well. So how this assessment going to have the negative impacts means if you are not competent enough to get the or do the assessment in a proper manner, right? So if your assessment is not accurate, and if it is not an accessible and reliable means, it is going to make a negative impacts, right? Improper choice of treatment options to the individuals. Yes. So if we are not following a guideline that proposed by the, that means if you are not following a proposed guideline, just taking the overview of the patient's informations, then the choice of treatment, it will get affect, right? For example, uh, in your a healthcare professional, so in his or her assessment, he doesn't sorry yeah in he his or her assessment, he doesn't notice that the patient is having allergies for the seafoods, right? Seafoods in the means like prawns, crab, or that cuttlefish. So those are the main seafoods items, right? So the major component or the some nutrient that is present in those seafoods are iodine, right? So the iodine is the major component present in the, like normally we are telling no salt means it is a iodized salt. So salt, where we are getting this salt from the sea water. So sea water, it is having a plenty of iodine, which is iodine crystals, which is present in it. So due after some process, we are getting this salt from the sea water. So the salt contains more amount of iodine, which is needed for the development of our growth of the body. Yes. So as seawater is rich in iodine means the organisms which are living in the seawater also having rich in iodine, like crab, fish, most of the fishes, right? So, your patient, he or she may having allergies to the iodine. Allergies means the body cannot tolerate the iodine. So, if they eat the iodine, they may develop some itchiness, swelling, or sometimes in a very extreme manner, some people they can't, they may suffocate for breathing, right? So, this allergic may cause those actions as well. So in that sense, during your assessment, you didn't get a proper assessment from the patient. That means you didn't ask about whether the patient is having any allergies or not, right? So soon after your assessment, the physician ordered the patient. So because they also go through and the physician, they plan to have a radiotherapy. Radiotherapy means, so normally we are using especially this iodine and the radiations to cure some disease conditions, right? So the doctor, the doctor plans to have those iodine therapy to cure the disease of the patients, right? But the physician also not aware about the iodine allergy, and also you also not aware about the iodine allergy. And we can't expect the patient needs to be aware about that, because not all the patients are having that much of knowledge, right? So if it is a very normal lay person, actually they doesn't know what these crabs and the prawns are contains, right? So and even sometimes they don't know about, they doesn't know the name iodine as well. So in that sense, it is our duty to get a proper information. So now what will happen, so they prepared and they get the consent from the patients, and now without any knowledge they started the iodine therapy. So when they start the therapy, after sometimes the patient starts to suffocate more and more, and the patient develops itching and swelling. Then only they will identify, and after that, if the physician asks, so the patient may tell, yes, I'm having allergies for the seafood. So seafood, in the sense, it is contains more amount of iodine. So seafood allergy means the patient is allergic for the iodine which is present in the seafood, right? Not for the fish or anything. So fish allergies for the fish means the constituents of the fish is allergy. The constituents of the prawn is allergy. So what is that constituents? It is an iodine present, which is in the iodine which is present in their body. So again, what it will going to cause for the patient? The treatment is going to be, so the patient is now in danger. Why? Because in between the treatment, the patient are suffering a lot. So here, so there are two sides. So both the physician and the nurse are responsible for this fault. Why? So the even when the physician is asking the questions, he also needs to be aware about the patient's allergies. At the same time, the second time, nurse is also taking the informations, but he or she also doesn't notice about the allergies. So now you can know how this assessment is important, right? So during the assessment at the very beginning, if they notice the allergies, then these problems won't happen. We can change the patient's treatment options from iodine therapy to any other options, right? So the improper choice of treatment options to the individual, which can make the individual life to end up in danger. Not related to social dynamics, right? So not related to social dynamics means each and every day the social activities are changing. Dynamics means changing, right? When you take anything, the any behavioral or the environmental activities, each and every day it's changing, right? So while for I think for 2 or 3 years, we normally, that means in 2020, the head topic of Sri Lanka is this corona. Not only in Sri Lanka, when we talk about all the world, the corona issue is the very top one. So that talk prevailed about 2021 as well. But now in Sri Lanka, so 2 or 3 months before, the hot topic was the economic crisis of Sri Lanka, right? Even in all over the world, still other countries also facing some economical crisis. So nowadays we are not thinking they are telling the corona is still there, but most of the people are not wearing masks and they are not using the proper hand washing. So only there are one or two people they are just wearing the mask because now the hot topic is economical crisis, right? So once you, even within 2 years, the social dynamics, the social topic, it's changing. The social activities are changing, right? So you can't find out the 2022 Sri Lanka is not similar to the 2000 Sri Lanka, right? So in 2000, the way that we had our lifestyle are changed when compared to 2022. In another 10 years, again, the Sri Lanka is going to be changed in vast, right? Not only Sri Lanka, the world, the population also going to, because why? Each and every day we are having so much of changes in health sector, financial methods, economical, sorry, technological, medicine and political. So each and every sector, every day, every second, not every day, every seconds we are having some changes, right? And it is common, right? 2 or 3 year 3 months before, so when we ask a price list of one item at the morning, so if we ask the price of the same item in the evening, again they are telling the price was increased by 2 rupees or 3 rupees. So each and every night they increase the price list, right? So they are changing. So this assessment is important, right? So without assessment, you can't identify whether there are any changes happening in the social, right? Poor planning, yes. So no, if there is no any informations, you can't know. So you are not, you can't have any idea how you are going to achieve the goals that you have planned, right? So in for the proper planning, you need to have an assessment. Inability to achieve the goals or objectives effectively. Yes, again, why? Because if there is no assessment, no proper planning, if no proper plan is going to execute, then your goal achievement will be failed. Time consuming, yes. So this assessment process is, it's a little bit time consuming if you followed in a good manner, right? So if your assessment is in an accurate manner, it may take around 30 minutes or sometimes 1 hour if you followed a proper assessment process, right? Insecure care profession, right? Again, so if the assessment process is not an accurate one, patient patients, so they develop that here you are the person who will uh, do all the things that the patient needs, right? And the patient also develop a secureness from your care. But if you go to the patient side and just ask just the name, age and gender and not going deep into the patient, just getting overview of the patient information in the sense, what the patient may thinks that, okay, so this person is not concerned about my feelings, right? So he's just coming and taking some informations for himself and going, right? And sometimes patients may try to tell more things to you, but if you refuse to ask from them, again the patient may think, right? So he is not ready to ask my problems, then how he will provide a good care to me? So whenever you try to provide a care or try to convince for any care, the patient will feel always insecure and they always try to refuse the care that you are going to provide. Dissatisfaction of care by the individual and the families, yes. So the care they won't get satisfied, right? Even the family members as well, because sometimes the family members they may visualize directly or they can get those informations from the individual. So both the individual and the family members are going to have some dissatisfaction. So these are some of the common negative impacts we can get from the inappropriate or the improper assessment process, right? So now we'll move to how we can develop a care plan. So before that, so are you all clear up to now? Or do you have any doubts so far?
Dear ma'am.
Okay, thank you. So now we'll see how we can develop a care plan for a patient management or right. So first we'll see what is this care planning. Okay, care plan means planning a care. So what is this planning a care or care planning means? Care planning required whenever assessment occurs, right? So in any situations, whenever you are writing an assessment, the next steps will be planning a care. And on the other side, whenever you need a planning a care, you need to make an assessment. So both sides are there, right? So if there is an assessment, yes, you need to plan a care. If you need to plan a care, you need to make an assessment, right? Dynamic process that incorporate care coordination, case management, referral, feedback, review, reassessment, monitoring, and exciting, right? So this care planning is a dynamic process, right? It is not a constant thing. That means constant thing means if you plan a care on 2020, it cannot be applicable even after 2 days within the same year, right? So 2020, October 16, you plan one care. That care, even it won't applicable within 1 hour or 1 second after your planning, right? So that is we are telling it is not a constant one. It is a dynamic one, right? The planning it's going to be changed. Within 1 second, yes, you need to change your planning, right? So what this care planning incorporate, including means it includes the care coordination, right? So the coordination of the care. So how you are going to provide a care? What are the things? Who are the personals you are going to involve? So it's a care coordination. Case management. Case management means how you are going to manage the condition of your patient. In the hospital setting means it's a patient. Or if it is the community management means so how you are going to manage the particular problem or the issue faced by the patient, sorry, that particular community. And then referrals. So if we studied what is this referral means, so whether we need to do any referrals or whether we need to get any feedbacks or reviews. And yes, so whether we need to have any reassessment, monitoring and exiting. So yes, so with the care planning the care, we can make a reassessment as well. Why? So first, in the first assessment, you can get some informations, and with the information only you are going to plan a care. So after planning a care, you will execute and finally you will evaluate how the outcomes and the assessment process. So with that evaluation, you can identify how the patient is telling, right? So with that feedback, right? With the feedback, you can identify whether the assessment you received or you made at the very beginning is okay or not. If your evaluation is not satisfied, it means the planning is not well executed, right? So the execution of the planning is not well. So the planning that you made is not well. Then the assessment is not enough. So it's a kind of chain, right? All the parts are interconnected. If anything happens to one part, it is going to affect all the other parts. So not each and every part are working independently. Assessment is going to make an impact on planning. Planning is going to make an impact on evaluation. Evaluation is going to uh, make an impact on again assessment, right? So that means it is a cyclic process which each and every components are interconnecting and they won't work individually, right? So as the care planning, so how it will be started, as I already told you, whenever there is an assessment, you need to plan a care. So you take a assessment from the patient for any disease condition. So you formulate a plan with that assessment. Then you implement your plan that you made or you prepared, then you will evaluate. Okay, so that evaluation will provide a feedback to you, right? So why we are evaluating? To get a feedback, right? So again, with the feedback you can identify. So if the feedback is not in a satisfactory manner, so feedback, that means evaluation, right? So evaluation is not good. So evaluation is not good in the sense you didn't reach the goal that you have made. Okay, so the goal, the goal doesn't achieve. So goal doesn't achieve. Why? The implementation was not good. So implementation was not good means the planning was not good. The planning was not good means the assessment is not enough or not good. So what you need to do? You need to do the reassessment, right? So in order to make or in order to achieve the proposed goal, you again need to identify it or explore in depth. So that is reassessment. So now here you can see, so the planning is going to change according to the assessment, right? So you can't apply the same planning once you identify the new things with the reassessment. So that's why we are telling this care planning or planning the care is always a dynamic process, which including the feedback, review, reassessment, monitoring, case management, referrals, and care coordination, right? Care planning involves discussion, negotiation, and decision making between who, right? So between who means, so yes. So care planning involves always the discussion between not only a patient and the client, but all the people. So, or normally we are telling that the health and social care sector, we are following a multidisciplinary team approach for improving the patient-centered care, right? So patient-centered care means the patient is the important one. Multidisciplinary team approach means, I already explained you, if one patient admitted to the hospital, only one healthcare professional is not enough to heal that patient, right? So doctor is important for return all the history or all the problems of the patient. Nurse is responsible if there is a need to take the blood from the patient. Medical laboratory technologists are responsible for identifying the particular organisms or whatever the problems present in the blood. Radiographers are important for taking the X-ray in order to identify whether the person's bones are having any abnormalities. Physiotherapies are important for healing the bone problem and if there is any muscle problems. And speech therapists are important if the patient complain about unable to talk. So if one patient admitted to the hospital, so there are a lot of discipline personnels are involving. That's why we are telling the health and social care approach is a multidisciplinary approach which will be helpful to enhance the patient-centered care, right? So when you are planning a care, you need to discuss with each and every other personals as well, right? So if the patient is having any fracture, you need to talk with the radiographers or the radiologist in order to take the x-ray. Or if you need to provide exercise to the patient, then a doctor will write referrals to the physiotherapist. Or if the doctor if the patient needs any specialized problem like heart problems, then the normal general physician will write a referral to the cardiologist who is a specialized for a he's a heart surgeon, right? So they need to have a discussions and they need to make a decision, right? So decision making in the sense, here again we are going to incorporate the patient as well as the family members or the relatives or the spouse or whoever the persons when we are making the decisions, right? So care planning. Planning a care means it is not done by a one personnel. So it is a kind of group activity, right? So under in that group activity, we are going to involve different disciplinary persons and the patient and the family members. Service providers and consumers to define goals and strategies, then identify the actions and services to meet those goals. So here service providers and the consumers means, so the healthcare providers and the patients, right? So both the healthcare providers and the consumers, they need to define a goal and strategies, right? So they need to plan. That means we are incorporating the patients also inside our care planning, right? And we need to identify what are the actions and services they are, what that means, what we can do in order to meet those goals, right? So this is regarding the care planning. Are you all clear up to now regarding the care planning? Or do you have any doubts regarding care planning, the introduction about care planning?
No, Miss.
Okay. Now we'll see the benefits or the advantages of developing or having this planning the care, right? Assist the consumers in achieving the goals, consumers or the patients. And so it will help for the patients or the care receivers or the consumers in order to achieve the formulated goals. So in the patients in the sense, so we will help so their goal is to achieve a recovery, right? To improve the quality to achieve a quality of a life, quality life. And if it is other health sector, other workplaces means, so each and everyone they will formulated a goal, so they needs to achieve those goals. Encourage active participation, yes, of both the care providers and the care receivers. They will encourage, this care plan, it will encourage for both the parties to actively participate in the care. Manages long-term care or the continuity. Yes. So when we plan the care, it will help to manage any problems for the long time, right? So because why? When we plan a care, it is a kind of written document. So we will write, right? Each and what are the things that what we did to the patient. So whatever we plan, we will have a written document. So that written document we can use for the future care plans. That means for each and every time. So first day, the patient, we prepared a care plan like this. For the second day, what we did. For the third day, what we did. So in the sense, so if there is any long-term problems, so we can manage the patients, right? Because if there is any problem arise after 12 days, then as it is a written document, we can go through what we did for the first time and what we are doing now, right? So the continuity of the care for the long term management, it will be useful. Provides documentation, yes, so all of them, whatever we are planning, they are written documents. Encourages a team approach, yes, I already told you, normally it is a multidisciplinary team approach, right? And increases the consumer awareness of services. Consumer awareness means healthcare receivers, right? Why? Because all we are writing, right? All we are writing, and normally we are incorporating the particular individual to the plan as well. So they also know what we are doing, right? So without informing to them or without involving them, Actually, they doesn't know. But once you plan all the care by incorporating them, they also may have some awareness, right? So this is my body condition, this is my disease conditions. So those people are working, putting their efforts for the healing of my problem. So there are different options available. So why they choose this particular problem? Because it is good for me. So likewise, the care receiver also may have some ideas, aware about the services. So they won't blame in the future. If anything bad happens to them, they won't blame because they also takes the accountability when planning the care. Right. So if they decide that they need to do this care management, but if the physicians instruct not to take, that means so they need to take the responsibility, so they can know, right? So yes, already the doctors, they instructed me not to follow this, but I am the one took this, right? And effective monitoring, yes, with the proper care planning we can have a monitoring in an effective manner. And when we talk about the care planning, so what are the key features? So what are the characteristics of a good planning of care? Nominate single care provider who has a specific roles and responsibilities. Yes, so it is common now. So when we talk about the healthcare setups, so it is a one-to-one patient care and not fit all approach we are using. So that what is this not fit all approach means? So the care that you are going to provide for one individual is not fit for another individual. Because why? Each and every individual are having uniqueness. So according to, so as we are having some uniqueness, this uniqueness will be expressed in our health status as well, right? So in that sense, you can't plan or you can't execute the plan of care of one patient to the another patients. That's why we are already telling this care planning is a dynamic one. Why? For one patient, you will plan one thing. Within 1 second, for the management of another patient, you are changing the plan of care. So it's changing. That's why it's dynamic, right? So for when planning the care, you need to appoint or nominate one single care provider for one patient. And that person is very much assured about what are the roles and responsibilities that they are having. Incorporation of care planning activities. Yes, so activities, it should be incorporated with the patient, family members, and other healthcare professionals. Provision of effective monitoring. Yes, the evaluation is important, right? So the major planning of care. So once you plan, after execution, your duty is not finished, right? You need to evaluate whether the planned care is functioning effectively or not. And coordination of referrals and feedbacks, yes, so it will be undertaken by the yes, you need to coordinate your referrals and the feedbacks and maximize the collaboration with other healthcare professionals as well. Yes, so you need to maximize the collaboration. Why? We are having a multidisciplinary team approach work. So you need to maximize their work, right? So these are the key features of the care planning. So are you all clear up to now? Or do you have any doubts regarding the benefits and the key features?
No, ma'am, go ahead.
Thank you. So monitoring. Care planning also includes monitoring, which will be helpful to ensure that the service is delivered as intended and is fulfilling the agreed goals. Yes. So planning means next to the planning, implementation. So you will implement, right? You will execute whatever you plan. So this monitoring means a kind of evaluation. So it is important, right? So we need to evaluate the planning that we develop, then only so we can ensure we can have some we can develop some idea that okay, the planning that we planned and executed are going in a smooth manner. So the planning we can achieve the goals that we prepared with the planning that we made, right? So for that, the monitoring is important. So the planning of care included the monitoring within itself. So there are some elements or the components are there when you are developing a care plan. So, right. So if you are going to develop a care plan, that means you are going to write a care plan. So if you are going to write a care plan means what are the things that you need to include in your written document? First and foremost, date care plan develop. Yes. So normally in a nursing, we are writing date and time as well. So if I am going to start to write a care plan means I will write the date and time when I'm start to write the care plan. So date it must, right? So time is also okay. You can neglect it, but the date is must. So why this date is must? Then only we can easily access, right? So after 2 or 3 years only we can easily access. So in that day what I did, in this date what I did in the previous part. So for the comparison, for the easy go through, this date is important. Issues or problems of the client identified or status. Yes, then we are writing in the nursing. The second part is the one I told you as a diagnosis, right? So in the nursing management, we are writing a part as a diagnosis. So in the diagnosis, what we are writing, issues and the problems which as a healthcare provider we identified from the patient, or if there are any issues or problems stated by the patient, right? So both the observation and the verbalizations will be included. Objectives or goals according to the identified or stated problems, right? So we will formulated the goals or the objective. If the patient tells that I am having a pain means the goal will be to minimize or to alleviate the patient's pain. That is the objective or goal. So according to that goal and objective only, we will formulate the plan and implement and do the evaluation. So we will have another part as a objective or the goals. Strategies or actions plan according to the identified or the stated problem. So once you identify the problem, you will develop a goal, and to achieve the goal again you are going to develop a plan of action or the strategies. That means how you can alleviate those problems. And time frame for the attainment of objectives or goals. Again, yes, you need to plan a time. Okay. So alleviate the pain means within how many days you can reduce the patient pain, or if there is any surgery, then how within how many days you can prepare a patient for the surgery, right? So the time frame is important. So you need to include the time frame within 1 week or within 2 months or 6 months, right? So because we can't do the surgery immediately for all the problems, right? So if the patient body is not cooperate enough for the surgery, then what will we do? So if the patient body is not cooperate enough for the surgery, we will do that. But we starts to prepare the patient body, right? So we will first 2 months we will instruct the patient to eat lot of healthy foods and prepare your body and don't get panic and reduce the blood pressure. So if there are any problems we identified that are interrupting the surgery, so first 1 or 2 months we make the patients to settle down those problems, then only we will go for the surgery, right? And if there are any emergency problem only, yes, we plan the surgery immediately. But if there is no any emergency situations, first we need to think about the patient body, then we will plan, right? So those things we are planning, right? So according to the objectives we are planning. So when we are planning, we need to maintain a time frame, right? So surgery means after 2 months we need to prepare have a surgery. So we ask the patient to admit to the hospital on this particular day after 2 months. So this is one important part you need to mention. Responsibilities for implementing strategies or actions. Yes. So what are the implementing strategies, implementing responsibilities? That means you plan your care. Is not enough, right? So once you plan, you are the person who needs to implement whatever you plan according to the order. And so you need to write as a planning part, you need to write. So what are the things, sorry, as an implementation or the execution part, you need to write what are the things that you did as your responsibilities. Participants in development of care plan. Yes, you need to include the participants. How? So under the evaluation, you can state that how the patient feels. If the patient can tells by their own feelings, then you can state how the patient feels after the treatment. And also in the care plan, that means the plan that you are writing, you need to write the patient some details like patient name, age, gender, and patient's ward number. So likewise, you need to write, right? So who is the patient? Because without writing the patient name and age, you can't identify, right? So to which patient, because one nurse, sometimes you may needs to write the plan of care for 2 or 3 patients one day. So per day means, so if you write the names for each and every relevant care plan only, you can easily identify. So to Mr. Pereira, what I did on Monday. So Mr. Smith, what I did on Tuesday. So Mrs. Natasha, what I did on Monday. So likewise, it will be easy for you to identify what you did to your patients as well. So for that, we need to include the participant some informations. Consumer acknowledgement. Consumer acknowledgement means after the evaluation, right? So if there is anything you need to get a written consent from the patients, yes. So you can get the sign from the patient. For example, like a surgery. So for the surgery, we are asking the patients to provide their consent that they are accepting by their wholeheartedly to involve in the surgery. So it is a kind of written acknowledgement, or you can ask the verbal consent or the verbal acknowledgement as well. Like, so if you provided the care for alleviating the pain, you can ask from the patients, so how the patient is feeling now. So the patient may tell, yes, I am now feeling very good. My patient was reduced. So thank you. Likewise, the patient may provide some compliments to you. So those are the verbal acknowledgement. So you can get the consumers or the care receivers acknowledgement by both verbally as well as by the written one. And reviewed date of care plan, yes, so it will be also helpful to write the review date of care plan, right? For review date of care plan means, so one, so you are putting one date and writing the care plan. If there is any instances you need to review whether it is okay or not, then you need to put the date of when you again reviewed your care plan. That means sometimes after the review, you may make some changes from the first day of your care plan. So in that sense, that putting the review date means, so it indicates, so okay, in this day, on this date, I made some changes. I reviewed the care plan, previous care plan, and I made some changes. And goal attainment, yes. So you need to mention both whether you achieve the goal or not. That means at very first you are writing what goals you have planned, and you need to include whether you achieve those goals or not in a satisfactory manner. So after pain, if the patient tells that my pain was reduced, means your goal was achieved. Why? Because you plan to minimize the patient pain. So now your goal achieved. So those things you need to include whether the goal achieved or not. So these are some of the elements you need to include. That means you need to write when you are developing your care plan, right? So these are some of the steps that you can use in order to develop a care plan. So first one is, first you need to check whether this person need a care plan or not. But it is common, right? So this question is not exactly needed, because whenever you take an assessment, you need to develop a care plan, right? So writing a care plan is mandatory for any patient, and it is important and it is very useful for you as well, right? So first, yes, you can identify whether this patient needs a care plan or not. what other care plans could this person already have. Then you can identify whether this patient already having any care plan, right? A kind of previous planning. Right? So the persons who look after that patient, whether the person is having any previous care planning or not. In that sense, you can think whether still now this patient's receiving. That means if the patient admitted for 1 week, so after 1 week, on the day of discharge, normally we won't write the care plan. Why? We are going to discharge the patient. In that sense, you can decide whether this person needed the care plan or not. How? By checking if there are any previous care plans or not. How would you explain to this person what a care plan is and why you think they will benefit? Yes. And you need to explain, right? How how you are going to, why you are going to write the care plan, because you are already involving your patient and the family members as well. So why we are writing this care plan and what are the components we are including and how this care plan is going to benefit the patient, right? So it is important. When you tell those benefits to the patient, then the patient also will become happy, right? How do you obtain consumer consent to the care planning process, right? So yes, so you need to receive the consent. I already told you, know, a signed consent or that acknowledgement or the verbal acknowledgement. So you need to plan how you are going to get the consent. Who are the people that who are the people that need to be involved? So under the care planning means apart from you and the patients, who are the other peoples you can incorporate, like other healthcare professionals and the family or the patient's close relatives. So who are the patients who are like, so you need to check who are the people you can incorporate others. How would you obtain and record consent to share informations, right? So how you can, so you need to record it. So how I can record, whether I can, if it is a verbal consent, so you need to record a voice note, right? And if it is a written consent, so you need to prepare a legal document and you need to get the consent. So how you can obtain and record the consent in order to share the information? How would you organize a case conference and who would be involved? So case conference means it's a kind of case presentation. So if you are going to present about your patient, in that sense, who are the people you need to involve? So why we are having this case presentation or case conference? It's like awareness in order to you are creating to other people. And at the same times with the case presentation conference, you can have, if you like to change the care of people, that means if a person already plan a care, but if you think that the plan of care is not enough for the pay as a management process, you need to change anything, then you can prepare a case presentation or case uh, conference, and you decide who are the people you need to involve. That means to whom you need to get an approval for changing the care, and you can present them. How would you agree on what the key worker would be? Yes. So what are the roles and responsibilities of a key person? That means of yours. Record all participants in care, their role and contact details. Yes. So if you include other than yourself, other healthcare professionals or other family members, so you need to include their roles, what they need to do, and about themselves and their contact numbers. Identify the key issues, agreed goals. So smart goals, right? So smart goals means specific, we already studied. It should be a specific goal, measurable one, and it should be reliable one and attainable one. So you need to attain. So, okay, goal means not just to formulate any goals. So however, you need to achieve that goals and the time management. So when you are preparing a goal for one patient, it should contain a smart objectives, right? And how do you decide on the review date? So how you can decide? So yes, you plan all the things and you are writing. If you need to review means how you can decide. So sometimes for your purpose, you can plan, okay, after 2 days or after 1 week or every 1 week, I can review my plan of care. So in that sense, depending on some instances or situations, you can decide on your review date. And how would you become confident that the consumer understand and agrees on the plan? Yes. So you need to check, okay, how you can confident. That means whether your consumer or your care receiver, whether he or she understand and accept your care plan or not, whether they support or not. So how much you are confident enough. So confident enough means how much, if your assessment is good, then you can develop a care plan. Because where, and if you, that means assessment is good means if you have a good assessment, then you can explore the patient in depth and you can have a thorough knowledge about the patient condition. In that sense, when you are developing a care plan, if a patient asks any questions, you can competent enough to provide the answers. So if you provide answers in a crystal clear manner, it will develops a kind of assurity on the patient, so the patient starts to incorporate in your care plan. So these are the steps and the elements. So the elements we studied, so those elements you need to include when you are writing your care plan, and these are the steps you need to check. So when you are developing your care plans, right? So today we'll stop up to this. So do you have any doubts so far? Are you all clear about writing the care plan and how you can educate the other peoples when we are writing the assessment? So, and what are the positive and the negative impacts of having this assessment? So, are you all clear or do you have any doubts? If you have any doubts, you can ask now.
Clear, ma'am.
Okay, others also clear or any doubts?
Clear, Miss.
Okay. So yes, you can go through the lecture note and the recording. I uploaded the lecture note to the class notebook as well. So as you all are not having any doubts, we can wind up the session now. And for the tomorrow, I will continue with the rest of the slides, right? So, okay, bye bye. And I'll meet you all tomorrow. Have a nice day.
Thank you, Miss.
Thank you.
Thanks, man.